Hi, my name's Joshua Richards. Welcome to WebsterOrthopedics.com. I am a hand, elbow, and shoulder surgeon, and I'm here to talk to you today about your post-operative care for a trigger finger release. In a trigger finger release, we'll make a small incision in your palm. If it's a thumb, it'll be down in this area. So you can count on a cut for a thumb being in this area, or depending on the finger in the distal palm. After surgery, the most important thing is to minimize the stiffness in your fingers. The best way to do that is to keep your hand elevated above your heart. The hand just needs to be above the elbow. You can do that by placing 2 to 3 pillows under the hand, keeping it comfortably above the elbow. You can do that with an armrest, with your elbow on the armrest if you're seated, 2 to 3 pillows under your hand. If you're sleeping, again, 2 to 3 pillows on both sides of you, so that if you turn in the middle of the night, your hand will end up on 2 to 3 pillows. The second part of that is that we want you making a fist every hour. Even if it feels tight, we want you to take your fingers and even push those fingers into your palm. You're not causing any harm or damage. What you're doing is making sure your fingers do not get stiff. So again, 2 things: keeping your hand elevated above your heart as well as above your elbow. You can use pillows to help you with that. And then every hour getting those fingers to touch your palm a couple times. You don't have to do it all day long, just every hour a few times. As far as the dressing goes, you'll have a soft wrap across the palm. We want you to keep that clean and dry for 5 days. The way to do that is to put a plastic bag over your hand so that when you shower, the water comes down over here, not touching the hand. If you'd like to clean your fingers, take a wash rag, rinse it out, and then individually wash the fingers so that the water doesn't drip down into the dressing. After 5 days, it's totally fine to remove the whole dressing. You can then wash your hands, soap and water, then take a shower, pat it dry, and then place Band-Aids over the cut. These larger rectangular Band-Aids that have adhesive around the whole, all edges, are usually a little better. Otherwise, you can do 2 simple Band-Aids. No soaking your hand, however, no swimming, no hot tubs, no dirty dishwater for 2 weeks. At 10 to 12 days, you'll come to your post-operative appointment, and then we'll remove those stitches. At that point, we'll tell you whether you can start soaking or not. So again, in review, keep your hand elevated for 2 to 3 days, make a fist every hour, and then after day 3 or during day 3, you could start to type again and write. But again, for the first 2 days, keep it elevated. Thank you.